I will be presenting on Graves' disease. So what is it? Graves' disease is an immune system disorder that results in hypothyroidism, or an overactive thyroid. Graves' disease can affect both men and women. However, women are 8 to 10 times more likely to be affected by the disease. It is also the most common type of thyroid problem. So what's happening? Normally the thyroid gets its orders to produce hormones through a chemical called the thyroid-stimulating hormone, or TSH, which is produced and released by the pituitary gland. What then happens is this hormone tells the thyroid to produce its own hormones, which control metabolism. And metabolism is directly linked to the amount of hormones that circulate in our bloodstream. Now, in a normal immune system, an immune system will produce an antibody which is designed to target a specific virus, bacteria, or other foreign substance. With Graves' disease, there's a malfunction in the immune system, and the immune system releases abnormal antibodies which mimic the TSH, or the thyroid-stimulating hormone. As a result, the thyroid is giving false signals to produce its own hormones, which causes it to work overtime and exceed its normal amount of hormone production, which leads to a very high metabolism. Causes and symptoms of Graves' disease. Causes include genes, so it is likely that there is a gene that makes someone more susceptible. Gender, like I said, women are more likely to develop this. Stress, pregnancy, infection, environmental factors, and age, so people who are younger than 40 are more likely to develop it. Symptoms include anxiety, irritability, weight loss, enlargement of your thyroid, a change in your menstrual cycle, rapid irregular heartbeat, and much more symptoms. Diagnosis and treatment. So with diagnosis, a doctor can use physical exams, blood samples, ultrasounds, and imaging tests. The treatment of Graves' disease is actually quite easy, although if left untreated, the disease can lead to some very serious complications. The main goal, however, is to inhibit this overproduction of the thyroid hormones and lessen your symptoms. Forms of treatment include a radioactive iodine therapy, which is where you take a radioiodine by mouth, because the thyroid needs an iodine to produce its hormones. And so this radioiodine goes into your thyroid cells, and the radioactivity then destroys these overactive thyroid cells over time, which causes your thyroid gland to shrink and eventually lessen your symptoms. You can also take anti-thyroid medications which interfere with the thyroid's use of iodine in order to produce the use of iodine to hormones. You can also take beta blockers which block the effect of hormones on the body. And finally, in more severe cases, you can have surgery to remove all or part of your thyroid.